Hello everyone, and thanks for joining in. Today we'll be discussing respiratory system infections, chapter 22. The respiratory system is complex and made of many different parts. It can be separated into two categories, the upper respiratory system and the lower respiratory system. The upper respiratory system contains the nasal cavity, oral cavity, pharynx, epiglottis, and larynx. And the lower respiratory system contains the trachea, the lungs, which have different areas, the upper lobe, the middle lobes, and the lower lobes. This image zooms on the upper respiratory system and pays special attention to the sinuses, the nasal cavity, and oral cavities. The pharynx, also known as the throat, and the larynx, which is your voice box, and tubes associated. And the epiglottis is the flap of tissue that covers your trachea when you swallow. There are many diseases of the upper respiratory system. Any disease that you see that ends in itis is an inflammation of that region. So the pharyngitis is inflammation of the mucous membranes of the throat. Laryngitis is inflammation of the larynx that affects the ability to speak. Tonsillitis is inflammation of the tonsils, sinusitis of the sinus, and epiglottitis is inflammation of the epiglottis. Here's an example of the epiglottis here. We'll be covering bacterial and viral infections. Bacterial includes streptococcal pharyngitis, scarlet fever, diphtheria, and otitis media. And the viral includes common cold. So streptococcal pharyngitis, also known as strep throat. It's caused by group A. Streptococci pyogenes is the only member of group A streptococci. They're resistant to phagocytosis, produce streptolysins and streptokinases. The inflammation of the pharynx and fever are present. It's often accompanied by tonsillitis and swollen lymph nodes of the neck. And it is typically treated with penicillin or penicillin-like antibiotic. Okay, let's discuss scarlet fever. It is a streptococcal pharyngitis wherein lysogenized or destroyed S. pyogenes produces an erythrogenic toxin. Erythrogenic means it causes reddening, hence the name scarlet fever. Its usual signs and symptoms are accompanied by a pinkish red skin rash and a spotted tongue that later becomes red and enlarged. It may also be linked to streptococcal skin infection. And while we're discussing toxins creating diseases, let's talk about diphtheria, which is caused by lysogenized Corynebacterium diphtheriae, which produces a potent exotoxin. The exotoxin is extremely important in the diphtheria, tetanus, and pertussis vaccine. There are now 5 or fewer cases of diphtheria in the U.S. yearly. It causes leathery grayish layer of fibrin and dead tissue in the throat. And it looks something like this. Before 1935, this was one of the most deadly infectious agents among children in the United States. And now it's protected against by the DTaP vaccine. Next, otitis media. This is earache. It's infection of the middle ear. It's caused by S. pneumoniae, H. influenzae, M. catarrhalis, S. pyogenes, or viruses. It has a pus buildup which puts pressure on the eardrum and causes inflammation. It's most common among children, however, where the auditory tube is smaller and more horizontal. Okay, next let's discuss the viral. The common cold It may be caused by one of greater than 2,000 viruses. This mostly infects the upper respiratory system. Body temperature might be slightly lower than human body temperature where it thrives the best. As few as a single rhinovirus virion can cause a cold, and virions can remain viable on surfaces for several hours after they have been shed by a host. Antibiotics are typically useless because the etiology is viral. About 30 to 50% of them are rhinovirus. About 10 to 15% are coronavirus. So since the temperature that it thrives in the best is a little bit lower than human body temperature, that's why you typically find them causing upper respiratory system illnesses. Correlation between cold weather and incidence of colds is not well understood, although cold and dry environments may help to preserve the viruses. So now let's discuss the lower respiratory system a little bit. This can include the trachea, which is the windpipe, and structures of the lungs, including the bronchial tubes and alveoli, which are air sacs that exchange carbon dioxide and oxygen gas with red blood cells between the circulatory system and the environment. So we have three different categories to discuss: bacterial, which could include pertussis, tuberculosis, and pneumonia; viral, which could also be pneumonia; respiratory syncytial virus, and influenza; and then fungal, histoplasmosis, coccidioidomycosis, pneumocystis, pneumonia. Sorry about that. Okay, pertussis. Pertussis is also known as whooping cough. It's caused by encapsulated Bordetella pertussis. They attach to the ciliated cells in the trachea and inhibit the ciliary escalator and releasing toxins. So remember, the ciliary escalator are those cells that move their cilia in order to push the mucus up out of the lungs. The catarrhal stage is a common cold-like stage, and then the paroxysmal stage is an intense, violent coughing. And it's actually the pertussis toxin that causes the symptom of disease. Okay, next up is tuberculosis, which is caused by Mycobacterium tuberculosis. It was believed to have been responsible for about 20 to 30% of the deaths in Europe in the 17th to 19th centuries. Today, we have a very low incidence in the US, and most cases are acquired abroad. It's very slow growing and has a waxy cell wall which is resistant to many antimicrobials. It infects and multiplies within macrophages. One can accomplish the Mantoux test, which is used for diagnosis. And this tests for an immunogenic response to a purified protein from M. tuberculosis, which is injected into the skin. Multi-drug treatment is used for at least 6 months in order to treat tuberculosis. The incidence of tuberculosis is greater than 10 million per year, so it is considered a pandemic. This shows a global map of incidence in 2016 per 100,000 population. The very dark colors you see in this map are greater than 300 per 100,000, or greater than 0.3%. So we see it has a strong prevalence in part of the East, in Africa, Mongolia, and then throughout Latin America, Europe, the rest of Northern Africa. So it is spread globally. Okay, now let's talk about typical bacterial pneumonia. 2/3 of cases are by encapsulated Streptococcus pneumoniae, or pneumococcal pneumonia. It includes inflammation of the bronchi and alveoli, resulting in high fever, difficulty breathing, chest pain, blood in the lungs, and with antibiotic treatment, mortality is 5 to 7%. There's a bit of a typo there. Mortality is 5 to 7%. Vaccine prevents up to 13 types of pneumonia. Okay, now let's discuss viral causes of lower respiratory systems, pneumonia and influenza. Viral pneumonia is usually caused by various enteroviruses, which are a group of viruses that infect mammals and are initially transmitted through ingestion, but can go on to affect other local areas of the body. And they're often a complication of influenza, measles, or chickenpox. It's an emerging cause in coronaviruses. SARS, or severe acute respiratory syndrome, is transmitted from horse bats. Only known outbreak in 2002 to 2003 affected greater than 8,000 and caused 900 deaths. And then we have MERS, Middle East Respiratory Syndrome coronavirus, which is thought to be transmitted from camels and has high mortality, but it's not highly contagious. We also have COVID-19, but with ongoing investigations, I didn't feel comfortable presenting on exactly where this virus was sourced from. Again, we've gone over the mortality rates of COVID-19. It's not quite as high as SARS or MERS, but it is highly contagious. Okay, influenza. Influenza viruses can be caused by type A and type B, which cause seasonal epidemics, and type C causes mild non-epidemic illnesses. They exhibit antigenic drift, which means they rapidly mutate and thereby they evade host immunity, therefore requiring a new vaccine every year, and it has a low mortality rate, less than 1%, but high incidence, which leads to large numbers of deaths, especially among infants and the elderly. Okay, finally, fungal diseases of the respiratory system are caused by airborne transmission of spores. And the one we're going to discuss is coccidioidomycosis, which causes valley fever or San Joaquin fever. It's caused by Coccidioides immitis. It's transmitted through inhalation of airborne spores, and it can cause chest pain, coughing, fever, weight loss. It causes spherules, which are full of spores, to develop in tissue, and the incidence is growing in Southwest due to drought and aging population. And that concludes this chapter. Thank you everyone for joining. We'll see you next time.